Children and youth mental health services has been running full tilt across the province during this pandemic, but are they keeping up? With us on that, both in the provincial capital, are Eastern Ontario Hub journalist Marsha McLeod and Ashley Okwuosa, assistant editor for TVO.org. Good to see you both again.
Hi.
All right, Marsha, I'm going to start with you. The article that you guys both worked on showed how the need for mental health care exceeds capacity. Can you catch us up to speed on the issue?
What we really found in our reporting is that the system is operating at peak capacity, just like you said. And we know that before the pandemic, actually, there was about 28,000 children and youth in Ontario who were waiting for community-based mental health support. And what we found is that during the pandemic, the number of children in some settings and with some conditions who are reaching out for care is increasing, and in particular with respect to eating disorders. So we heard that Sick Kids, for instance, their number of admissions to their eating disorder unit has increased 55% over the duration of the pandemic compared to last year. And that as well, clinicians really told us that children are showing up more sick when they arrive at the hospital and are requiring more intensive care when they do arrive.
Now, this was an article that took several weeks to put together. Ashley, can you tell us a little bit about the methodology behind it?
Yeah, I guess so. We started with really trying to understand the scope of the problem. And by doing that, we just started looking at existing media coverage. And we found that in the US, emergency rooms were seeing about 4 times more children and youth than normal. And like Marsha said, children and youth with the most complex mental health disorders are waiting the longest. So when we had a scope of that, we knew what kinds of questions we wanted to ask. We also knew that hotlines and helplines were seeing a spike. So we were able to gather data from Kids Help Phone, for example, and we found that about 4.5 million children and youth across Canada were calling. And in Ontario specifically, some of the major concerns were anxiety, stress, depression. And we also wanted to, get this information directly from hospitals in terms of capacity. So we created a short survey and sent it to about 22 hospitals in Ontario. We wanted to find out if at all their capacity had changed because of the pandemic and if they were seeing an increase in the number of referrals to their inpatient eating disorder programs, if they had any. And we definitely wanted to get the family perspective. So we really turned to Facebook groups online. Obviously, a lot of, in-person communication wasn't happening. So that was definitely one avenue that we used to find families to speak to us.
Now, Marsha, you mentioned eating disorders. You guys learned that eating disorders among youth are on the rise. Do we have an idea of what's attributing to that?
One clinician at Sick Kids said to us that a possible explanation is really the isolation and loss of routine that so many children are facing during this pandemic. And she also cautiously suggested that another contributing factor could be the increased internet time for children during the pandemic. And really what that means, though, is increased access to sort of dieting or exercise content. And another clinician in Kingston said to us, really look at the loss that children have faced, whether that's and of their outlets of school, of maybe seeing friends, of sports. And even one parent of a child who's struggling with an eating disorder, she said to us that she thought that perhaps her daughter's eating disorder and this real intense focus on dieting and exercise was sort of a misplaced way for her to put her energy and focus onto something in a time where so much was up in the air.
Actually, I want to follow up on that. When we talk about eating disorders, what's at risk when young people have to wait for the right type of treatment?
I think Marsha alluded to this, but like clinicians have told us that young people are coming in more serious condition. And, one clinician said, we'd like to be getting to these kids much earlier, because if not, they're coming in what was described as medically compromised situations, which could look like, a lower resting heart rate, for example. And I think really the emotional and physical strain on the youth themselves who are experiencing the eating disorders and the families who are really seeking help. We saw a lot of parents and going to the emergency room repeatedly because their children were repeatedly in crisis because they didn't have help in the community. So that was one thing we definitely saw.
Now, concerned medical professionals say that the province's child and youth mental health system was severely overburdened well before the pandemic, and it's now worsened. Marsha, do we have an idea of what the government has been doing over the past 14 months?
In October of 2020, the Ontario government invested about $24 million into children and youth mental health. And we also know that in February of this year, they invested about $10 million into something called secure mental health treatment. Some advocate, and particularly at one center, including one center in Oakville, this is something that advocates found a little bit confusing because less than a week later, the government actually cut funding to that same center for very similar type of treatment to which they just funded. But overall, we do know that advocates say that the investments have not been enough, and that one estimate by an organization called CMHO says that $150 million is the annual price tag of getting the system up to where it needs to be. So that means an additional $150 million every single year to get to the place where children aren't waiting months or even up to years on wait lists for counseling and therapy services.
Now, you guys mentioned the Facebook groups. You spoke to a number of families who are struggling right now with getting the right kind of treatment. Ashley, I want to ask you, what stories stood out to you?
So there's this one family, Amber, Tom, and Hannah, Amber being the daughter, and they're based in Burlington. And it's been what can only be described as a roller coaster for them in terms of seeking help. Their daughter had dealt with an eating disorder prior and faced what, she described as a relapse during the pandemic. Over the last year, their daughter was admitted to McMaster Children's Hospital 4 times. And when she turned 18, was admitted to another, hospital multiple times. Finally, she was able to get help. She was actually able to get access to an inpatient program, and she was there for about a month. But I think what stood out to me really was the strength that this family was definitely able to, to muster in what was undeniably a difficult time in their life.
I want to actually ask you both this question. Overall, you guys have spent several weeks putting this together, speaking to a number of people. What is your takeaway from having done this research? And I'll start with Ashley.
So the general concern from physicians about what happens when the pandemic is over, that was evident. There was some certainty from them that there will be long-term effects to the mental health of children and youth because of what they're experiencing now. Of course, like a clinician said, we've never really been in this kind of situation before, so nobody knows what the future is going to hold. But they were fairly certain that the mental impact of this on children and youth will be felt for a considerable length of time.
And Marsha, I want to ask you any kind of takeaways. I know you spoke to also a number of clinicians and families as well. Was there anything that stood out to you? And was there anything, a takeaway from the research that you guys did?
I think what stood out to me and even just sort of with respect to what the family that Ashley shared about is and so many of the families that we talk to is just how tired they are 14 months into the pandemic, just that they have shown such capacity and resilience, but that it has been so exhausting, and that really a lot of the informal supports that they would have relied on are gone, whether that's family or church or after school programs. One parent said to me that I hope after COVID that we really just have more energy, because right now we're just trying to get through the day.
I do want a quick little follow-up with you guys in terms of, if parents are seeing this and, their children are struggling, where can they go?
It is a very complicated question, and it's hard for us to say. Parents can just look up this internet address and find out exactly where to go. And in fact, I think even the question just brings up that it really is such a complicated thing. And often it starts with the family doctor, but from there, often parents and families are zigzagging all around the system, and it often takes years to kind of get to where they need to go.
There are some community organizations that have come up with, like the Rock Center for Outreach. They've come up with programs that really are targeted at help seeking, right? So parents can call and say, this is kind of what's going on, or children can call themselves, and they're able to direct families to where they need to go. But like Marsha said, it really is a maze.
Marsha McLeod and Ashley Okwuosa, thank you guys both.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.